Hi, today we're discussing about Poractant Alpha, which is a drug. Poractant Alpha is a surfactant replacement therapy used to treat respiratory distress syndrome in premature infants, which occurs due to insufficient natural surfactant in the lungs, leading to breathing difficulties. Poractant Alpha improves lung function, enabling more breathing efficiency. So now let's discuss what is Poractant Alpha. Poractant Alpha is derived from pig lungs. It helps keep the lungs alveoli open, allowing better oxygen exchange in preterm infants with underdeveloped lungs. Now let's discuss about the scheduling and classification of Poractant alpha. Poractant alpha belongs to a drug class exogenous pulmonary substances. The schedule of this drug is S4 medication, which is prescription only. So now let's discuss its mode of action. Poractant alpha lowers alveolar surface tension, preventing collapse and improving lung ventilation and oxygen exchange. This is essential for premature infants whose lungs are underdeveloped and lack sufficient natural surfactant. Now let's discuss about the molecular binding and affinity. Poractant alpha's phospholipids DPPC and proteins SPB and SPC form a stable layer in the lungs, reducing surface tension and keeping alveoli open. These proteins strongly bind to the phospholipid molecules, facilitating the formation of a stable surfactant film, particularly during exhalation when the alveoli contract. Now let's discuss about the drug efficacy. It increases oxygenation and improves lung compliance, reduces mechanical ventilation needs and lower mortality, leads to faster recovery and shorter NICU stays. So now Poractant alpha plays a crucial role in managing RDS in premature infants. Poractant alpha stabilizes lung function and improves respiratory outcomes. Treated infants recover more quickly, leading to shorter NICU stays. Now let's discuss the pharmacokinetics of Poractant alpha. Pharmacokinetics of Poractant alpha consists of four components, which is absorption, distribution, metabolism, and elimination. The first one is absorption. Absorbed in the lungs via endotracheal tube where it remains locally. So once delivered, Poractant alpha rapidly absorbs to the air-liquid interface of the alveoli, forming a stable surfactant monolayer. The second one is distribution. There have been no studies on the systemic distribution of Poractant alpha in humans because its action is limited to the lungs and is not anticipated to enter the bloodstream in significant amounts. If any systemic absorption does occur, it is expected to be minimal and without meaningful pharmacological impact. The next one is metabolism. So, likely metabolized and recycled by lung cells. The next one is route of elimination. The elimination route for Poractant alpha has not been extensively studied in humans as its effects are confined to the lungs and it is not intended for systemic circulation. Now let's discuss the pharmacodynamics of Poractant alpha. It enhances lung function, improving compliance, gas exchange, and survival rate preterm infants with RDS. Our next topic is the interdisciplinary team involved in manufacturing or administering Poractant alpha. They are neonatologists, NICU nurses, pharmacists, respiratory therapists, and pediatricians work together to ensure optimal care for infants receiving Poractant alpha. Our next topic is counseling and administration of Poractant alpha, administered via endotracheal tube by trained professionals. Its common side effects are temporary drops in oxygen and bradycardia, which are monitored and managed. Infants are closely monitored post-administration for changes in breathing and heart rate. This one is the physiological effects of Poractant alpha in our different body parts. So now let's test our knowledge.